Okay, so joining me today is Pippa Scott from Fantastic Futures, and she's going to talk to us about trauma therapy for people who've experienced birth trauma in previous births. So Philippa is a doula and a perinatal therapist and a TRTP practitioner. So, Philippa, can you tell us a little bit about what constitutes birth trauma? And then we'll look at the therapy that you are involved with.
Sure, thanks, Leonie. And that is quite a mouthful, TRTP. It's a lot to try and say. So birth trauma. Birth trauma can occur not just in birth, but around pregnancy. For some women, it can occur in fertility. So I find that in my work, birth trauma is a little bit limiting because a lot of women will experience pregnancy trauma, they'll experience postnatal trauma, and then, of course, there is birth trauma itself. There's two types of birth trauma, in my opinion. One of those is catastrophic events that might happen to endanger mother and baby. And that happens, thankfully, very infrequently. What I do see a lot of, though, is birth trauma as a result of things like obstetric violence, birth trauma as a result of coercion, a loss of choice, birth trauma because of feeling unsupported, isolated, alone, not being given the full options. It might be because things happened that weren't expected. And that can sometimes not be necessarily big T trauma. We think about trauma and we think war and we think somebody dying, we think, a fire and so on. But trauma can be what's referred to as a little T trauma as well. It might be being left alone when in fact you're suffering from anxiety. It might be having to make a decision that you felt unsupported in. It might be having to fight for your rights in a scenario like birth. So little T traumas can occur as well. And when we're in something as emotive and big as birth, that can have huge effects for both mother, baby, and everyone in her sphere.
So obstetric violence, they're sort of big words, or the idea of violence. So how would you describe some obstetric violence, some examples of that?
Yeah, so obstetric violence can, it's a very gendered violence, obviously, and medical violence is known, but obstetric violence is very specific. And obstetric violence can look like things as, doing a vaginal exam without consent. That's obstetric violence. Doing an episiotomy without consent, which unfortunately occurs. Obstetric violence might also look like coercion, being told that your baby is in danger or your baby's going to die if you don't have an induction. That's obstetric violence. That's not okay behavior. Having somebody tell you that if you don't get induced now at 38 weeks because you've got a big baby on board, you could kill your baby, that's obstetric violence. That's not okay. So unfortunately, we see a lot of that. I see a lot of that in my work, where women have been told something false, or the risks of something have been exaggerated to the point where they've felt compelled to make the decision that the staff are suggesting that they make. So it's actually that can cause a whole lot of distress in a woman's body. It can cause a lot of distress and doubt in her ability to birth and do all of those things, even breastfeed and so on. When you get a woman who's told that she needs to be induced because her baby is too big, the first thing that happens is that she looks inside herself and says, wow, well, maybe I'm not enough. Maybe my body has built a baby too big for me. Maybe it won't go into labor on time. Am I faulty?
Mm.
That's not okay for us to be doing that to women. And so it sets up a whole cycle then, or cascade of not trusting in our own ability to give birth.
Mm. And yeah, I mean, it just seems so simple, and it's about respect, isn't it? And treating people with, not dehumanizing with certain behaviors. So how does an experience of birth trauma impact on subsequent births in your experience with trauma?
Yeah, so um, it can go kind of one of two ways. Often women will experience a traumatic birth and then they'll choose, and whether that was a cesarean the first time or whether that was a vaginal birth with maybe an episiotomy and a big tear or something like that, what will then happen is that they'll choose a scenario where they feel that they have control.
Mm-hmm.
And often that's with an elective cesarean. So they choose the model that allows them to choose who's there, to know who their care providers are, to have had the conversations beforehand about what they want and how it's going to go. And the easiest to control is an elective cesarean.
Mm.
And so a lot of women will choose to do that because they feel in control of that scenario. The other way that it can go is, of course, that it can cause women to become very make decisions based out of that fear. So some women will choose to free birth out of fear of being in the hospital scenario. Some women will go out and get lots of information, become informed, and choose to have, perhaps a home birth where they can have their chosen care providers, and do it in a safe way and feel in control there. Other women will become very defensive in their decisions, and so every hospital appointment is a fight to have their needs met and to have their rights acknowledged and abided, and then there's this whole idea of having a redemption baby, which just breaks my heart to think that women feel that they need to have another baby to redeem themselves, to redeem their birth, to have a healing birth in order to get over the past birth experience. Now, I have two problems with that, one of which is that the first birth, saying that we have to redeem ourselves from that birth, implies that it's solely our fault, that
Mm.
it has nothing to do with the system of birth, but that it has to do with us somehow failing in
Mm.
that space.
Yeah.
And so to have a redemption baby is I think a falsity, because for most women, it was not about a deficiency in them, but in the system
Yes.
that caused that problem. And so we're placing the blame in the wrong
Yeah.
place. The other problem I have with that is that we're placing so much emphasis on the next birth going perfectly, that
Mm.
everything we want has to happen in order for us to heal. And
Yeah.
that's so much pressure on this birth. And it actually takes away from the joy
Mm.
of birth. It takes
Yes.
away from the that knowing. And I actually did a TikTok yesterday about the idea between instinct and intuition. When we're working in fear, we're working from a place of instinct. We're saying, how do I keep myself safe? What do I need to do in order to be
Mhm.
safe and heard and so on in this scenario? That's very much an instinct space. But birth allows us a beautiful opportunity to connect with instinct, because birth should be about love. And we should be able to make decisions from that place of love and intuition,
Yeah.
which is a deep knowing
Mm.
about our body and about our baby, and a trust and faith in that space.
Mm.
And so that's where, in my work, what I want to do is be able to get women to that place of intuition
Yeah.
rather than instinct in the
Mm.
birthing space, which means healing the birth trauma we get to um, before we get to the next birth. That way, the birth is healed, and this next birth is what it is. And
Mm.
even if it doesn't go perfectly to plan, it can still be a joyous,
Yeah.
non-traumatic experience.
Yes.
Mm.
So how do you do that? Healing. How do you heal a previous birth trauma? What's the process?
Okay, so a lot of women feel that if they can just debrief their birth, it's enough. And sometimes it is. Sometimes simply understanding the process or what occurred and how it occurred and all the bits and pieces around it, sometimes it's enough to know those things. And some hospitals offer debriefing for women so that they can understand what happened in that space.
Mm.
But if you've experienced birth trauma, debriefing the birth with the people who were there as part of that trauma is often going to be re-triggering.
Yeah.
And it's when there's real trauma sitting there, it's often not enough. And so with the process that I use in TRTP, we actually get to deal with the trauma and the traumas that preceded birth trauma. I don't know about you, Leonie, but I didn't have a perfect life before my birth trauma. Right? My birth trauma was kind of the nail in the coffin.
Yes.
Yeah.
Yeah.
So where we get to is we actually get to a space of being able to deal with all of the subconscious core beliefs, the traumas from our own childhood or teenage years or whatever they may be. We deal with those as well, because then we can actually reset that nervous system to a place where it can actually activate properly, and we're not sitting in that fight, flight, freeze space. So with TRTP, we do a 3-step process, which occurs generally over 3 or 4 sessions. So in that, we actually look at what are the subconscious core beliefs that we have about ourselves. What did we take on when we were a child that set us up to to be bullied, or to be able to be abused, or
Mm.
to be too afraid to speak, to not want to be seen. Where did all those come from? And let's rewrite those. So in our very first session, we look at those subconscious core beliefs and we rewrite them to the positive. In our second session, we actually deal with the big or little T traumas that are running our life, that have us set in a place where our autonomic nervous system is in constant fight, flight, freeze, or appease. And we reset the system back to it's like a factory reboot on a mobile phone, Judith says, where we actually wipe all that excess data, we reboot the hippocampus, and all of those events are actually put into long-term memory where our conscious mind knows them to be, but our unconscious mind isn't aware because they've never been filed properly. They're just running like a videotape loop in our subconscious. So we put them away, we deal with them, and we get them done. And we do that in a very non-triggering way, so that all of that stuff doesn't come up. And you know what? We don't even have to talk about the story, Leonie. I was working with a client just recently, and we dealt with her birth trauma, and then in a different space, I asked her to tell me her story. And she was able to tell me her story without it re-triggering her because we'd already dealt with it. But we actually went into that and dealt with the birth trauma without even going into the story. And for a lot of women, that is a huge blessing to not have to go in and
Mm.
retell the story again. We just fix it. So that's the second session. In the third session, I know it's pretty cool.
It's amazing. Yeah.
In that third session, we write a future the way we want it to be. And for some women, that includes imagining the next birth. And if they're, if they're planning more children or are already pregnant, I'll actually give them an imagining to use to to program their subconscious for the birth of this next baby, which having done that myself for my third birth is such an incredible way to prepare for the birth of a
Mm.
baby. Yeah.
Oh, it sounds such a gift to self, really, to be able to have that opportunity to go in with a clean slate and not to be, carrying that trauma, the PTSD, and be so at risk of triggers. I think it sounds fantastic.
Yeah.
How long has this therapy been available? Because I think the language birth trauma and obstetric violence is only fairly recent. So how long has this been around?
Yeah, so Judith's been practicing TRTP for well over a decade, but she's been teaching since 2014.
Mm.
So it's been around a while, but of course with anything like this, it takes a while to get out there. And not everyone specializes in birth trauma. I hear far too often of women going to see a psychologist with birth trauma, and their psychologist simply saying, well, you've got a healthy baby, so you should just get over it.
Mm.
And that's their experience of a mental health provider.
Mm.
And that's not okay. We need to be supporting these women, because the fact of the matter is, when we have something like birth trauma or postnatal trauma or even pregnancy trauma, it actually affects our parenting.
Mm.
We parent from a different space when we parent out of fear. There's a hypervigilance that can occur. Um, there can be parenting out of guilt. That was me. That this helicopter parenting is not a normal phenomenon. It doesn't come out of the crime-driven world. We have less crime now than we did in the 40s and 50s, and yet back then, children weren't helicopter parented.
No.
Um, but we do that now because we feel that it's within our control and it's something we can control. But that comes from the birth trauma. It comes from maybe childhood trauma. It comes from all sorts of different spaces. But when we take that and we apply that fear and the triggers to our parenting, that can be huge in terms of how our children then feel about themselves and their space in the world.
Mm.
We talk about this generational trauma. We talk about breaking the cycle. Well,
Mm.
that's exactly what TRTP does. TRTP gives us an opportunity to truly break the cycle and to truly stop that generational trauma right here, right now, with us, so that we can then parent from a different place.
Oh, that sounds wonderful. What a breakthrough for women. Are you able to give
Absolutely.
any case studies or of a recent case that you've worked with, and the impact of TRTP on their trauma, without using
Yeah.
names, of course?
Yeah, yeah, of course. Um, there are loads of incredible things, and I really want to point out too that dads suffer from birth trauma as well. The experience for men or partners at birth can be very traumatizing, because they're out of their depth often, and the person they love most in the world is seemingly in danger.
Mm.
And that can be a huge thing for men. And I recently worked with a couple whose experience of birth trauma was found. And each of them had actually had therapies, different modalities prior and over decades. And no one had managed to shift any of their other traumas or their childhood stuff.
Mm.
But when we worked together, and we worked together separately, so I worked with dad separately to mum. We worked on their individual stuff, and this was a couple who very quickly after the birth of their child realized that they probably weren't going to make it as a couple,
Mm.
unless something radically changed. And so we worked together. We did their sessions over 3 weeks. And at the end of that time, both of them felt empowered in themselves, empowered in their relationship. They felt connected to each other, to their baby. They weren't, for her, she'd had experiences of wandering around the house, not even able to have a shower because that's where so much of her labor had occurred, was in the shower. So to be able to be clear of that, and she was clear of that particular part of it after our intro session. We hadn't even got anywhere near it. So, those are the kinds of results that are life-changing, for a young couple having their first baby together, to be able to be free of that kind of triggering, the pain, the hostility that occurs between a couple sometimes when there is trauma and triggering, can be quite huge. And then instead of supporting each other, they're at each other's throats, and that's not going to help anybody. So by doing that, we were able to clear it for both of them, clear their childhood trauma as well as the birth trauma, and be able to move into them parenting this beautiful child from a space of love, and to see the pictures and the love and joy that's happening there now is quite incredible. Yeah.
Oh, that's just amazing, Philippa. And it makes me think that, had the trauma not happened, they wouldn't have had this experience of dealing with their own traumas and cleaning the slate and having a new beginning. So that's extraordinary.
Yeah, and look, I have a passion for people actually getting to deal with their stuff before they become parents. I think if we can take a step back in our planning for a baby and go, okay, I'm consciously wanting to become a parent. What do I need to do to be ready for that? Because the birth is a pivotal moment, but it's only the beginning of the rest of your life as a parent. And Leonie, you know that. You've got older children than I do. Right?
Yeah. Well, good luck with that, Philippa. I can't imagine anyone doing the work before, the way our society is, working right up until the birth, and like it's just so busy. I mean, I agree with you wholeheartedly. It would be a great place to start, but I can't imagine that really taking off. However,
I believe in miracles, Leonie.
yeah, you believe in miracles. Okay. Well, it's a good idea, and it's something that I could promote through my business, and hopefully it would take off. But for people who would like to experience the release from birth trauma, where can they find TRTP practitioners?
Yeah, so you can find them on the TRTP directory. There are some that have birth trauma experience. If you reach out to me, though, I'm more than happy. If I do work in that space specifically.
That's your niche, isn't it?
It is my niche, yeah. So the birth trauma, but also anything to do with that sort of parenting, the postnatal side of things, even the fertility side, parenting overwhelm, all that sort of stuff. So anything sort of perinatal. But if you want to work with someone face to face in a location where I don't exist, I do a lot of work online, and I do have a face to face clinic here on the beautiful Sunshine Coast. But for those who aren't local to here and want to do face to face, if you reach out to me, I can suggest a practitioner who is in your area, who I feel would have the slant required to do birth trauma work, because it is very specific and not everybody is equipped.
Yes, absolutely, and attuned. And having been through it yourself, I mean, the benefits. So the website, where would that find you?
So my website is fantasticfuture.com.au. I know the business is Fantastic Futures, but I couldn't get the one with the S. So it's Fantastic Future. I'm on Facebook. I'm on TikTok. I'm on Instagram. I'm on YouTube as Birth Trauma Buster. So there's lots of ways to find me. But fantastic, if you Google Fantastic Futures, birth trauma, you'll find me, no problem. And I'm more than happy to help whether you're local to me or not. I work with couples all over the world with birth trauma. So yeah.
Oh, that's great. And TRTP, what would that website be?
So it's TRTP therapy. And that's where you go if you want to learn a bit more. Judith also has an incredible YouTube channel where people can watch videos about TRTP and people's experiences of it, practitioners' experiences of it, and so on. So there's some great, I mean, that's what I did after I went looking for something and I devoured the YouTube channel and then went, oh, wow, man, I have to do this, because I was suffering from adrenal fatigue some 16 years after my birth trauma. And I needed something. And my GP wanted me to take 3 months off work, God bless him, and I couldn't afford to do that. So I had to find a solution that would work and that would be fast. And that's what I found was TRTP. And it was so incredibly healing from both a physical level, but an emotional level. And I parent so differently now. And I just exist differently in the world,
Yes.
Yeah. And my relationship is better. So, yeah.
Oh, that's fantastic.
I'm an enthusiast.
Yes. So Judith Richards' YouTube channel, where you would find a lot about TRTP and a lot of happy
Absolutely.
customers, and encourage you to contact Philippa at Fantastic Futures, or do your research on YouTube with TRTP. Thank you so much for joining us today, Philippa. I love what you do, and I think it's an absolute blessing for women who are struggling with the after effects of birth trauma. So thank you
Absolutely.
for your
Well, thank you for your time.
Okay.